This program is a paid commercial announcement from Jacob Media Partners and does not reflect the views of WPHT or its management. Today's program is pre-recorded.
Jacob Media Partners presents The Adam Malamut Show. Real people, real perspectives, real opinion. Presented by the law offices of Adam Malamut and Associates. Powered by InjuredWorkers.com. And driven by Jaguar Land Rover Westchester. Now, live from the Malamut and Associate Law Studios, The Adam Malamut Show. Hosted by Adam Malamut.
And a good evening, everyone, and welcome into the Adam Malamut Show as we come to you here on Talk Radio 1210 WPHT. It's football weekend tomorrow. Everything gets underway in Philadelphia. It's the Adam Malamut Show. Real people, real perspective, a real sports fan, and real opinion. Adam, all to you, my friend.
It's kickoff Sunday tomorrow, Kraus.
I love it.
Listen, man, we wait all season long. You know, there's a couple special weekends throughout the year. You know, we've got the weekends where all four sports are playing. We've got, which is, I think there's 2 weeks that happens. We've got a weekend like this weekend where my Philadelphia Eagles, I know that there's probably a couple people out there that are confused, that are maybe some, you know, misplaced interest in Giants fans, Dallas Cowboys fans. But this is Philadelphia, and in Philadelphia, we're Philadelphia Eagles fans. We have the Philadelphia Eagles playing. We have the Phillies playing some off and on baseball. I saw this past week there was a game that had a football score. The Braves, and I don't remember the final score, but the Braves ran up 22 runs in a baseball game this past week. I think it was,
got a little bit higher, too. Last I checked on the board, I think it was 29. I don't know if it ended at 29, but at that point, you punch out of the game.
I'm a little older, Krause. My bedtime's earlier, so I may not have followed it past the 22. But 29 runs. I mean, listen, that may be higher than that. As a matter of fact, that may be higher than the number of points that the Redskins put up in the first 2 weeks of the NFL season. So that being said, you know, we're moving into an awesome season. Hopefully, we're starting to put the pandemic behind us by being more socially responsible. We are hopefully starting to adjust to homeschooling and our children having different schedules than what they're used to. I know that in our household, it's been the same challenge that other folks have had, where we have children in two different schools and we're trying to adjust. I know that we have businesses that are continuing to struggle. There's always that national and state struggle on how they can help and how they can do more, but at what risk. And we've got a lot going on, but I'm hopeful that as difficult as 2020 has been on so many people, I'm hoping that this now helps us turn the corner coming into the fall. And with that being said, as we turn the corner, one of the things that I know a lot of folks, myself included, have focused more on during the pandemic has been their health. And our special guest today is Dr. Charles McCabe. He's a board-certified chiropractor who, I want to talk about chiropractic in a second, has a holistic approach to health. And I'm going to ask you, our listeners, to listen to this show for the entire hour. There is going to be a lot of information here. When you talk about your health is not just your physical health. Your health is your mental health as well. And so much of your mental health has to do with how you feel physically. Chiropractic, in many ways, has kind of gotten stereotyped as you go into a doctor's office and the doctor cracks your back and you leave. That's not what chiropractic's about. Dr. McCabe's going to explain to us not just what chiropractic's about, but all the different specialties that he has and the special certifications that separate him from all the other chiropractors. Look, every single person that's listening has woken up uncomfortable, has had a day that they've woken up that they just didn't feel right, has had a day that they've woken up that they're sore. It might be their feet, it might be their knees, it might be their back, it might be their neck, it might be their head. But everybody has had those types of days. Dr. McCabe's going to talk about the importance of chiropractic in in helping to alleviate those issues. It used to be you call your general physician, they prescribe you a Z-Pack or, some pain meds, and all of a sudden whatever your ills are, they go away. And it's just not that simple. So that being said, Dr. McCabe, welcome.
Thank you for having me, Adam.
So let's dive right in. So, just so people understand your background, I mean, you're a chiropractor, you were a collegiate athlete. What I don't think your patients know, because you're humble about this, is when you got started in chiropractic, you treated a bunch of the Pro Bowl New Orleans Saints players. And I'm not going to give a time reference because I know that there's HIPAA issues involved and privacy issues involved. But you've been around sports medicine. You've treated people who've suffered from traumatic injury. You've treated people for everything from weight loss to chronic spine, shoulder, and joint conditions. Talk a little bit about chiropractic.
Well, what a lot of people don't understand as far as chiropractic goes is most people run to a chiropractor only, first of all, after they've been to their primary care physician. They've gone to the orthopedic surgeon. They've gone to physical therapy. And they have some back pain, and that's why they go to the chiropractor, which always surprises me because we are back doctors. We are the person you should go to if you have a back problem. The thing is we're not just about pain. And people have to realize that the nerve, when it's compressed, is what gives you the pain. But you got to remember that there's more to your body than just pain. Think about all the organs that run. Your heart, your liver, your kidneys, your intestines. You're going to absorb the nutrients through the food you eat, things like that. Well, those same nerves go to all of these organs and structures. So if you're pinching on that nerve that causes pain alone, that nerve's carrying a bunch of other information. And it's carrying information to the pancreas that's telling the brain's telling it to secrete insulin, or the nerve's going to the intestines and it's telling it to absorb nutrients and different things like that. Well, if you compress that nerve, you're stopping that same information. So overall health can be affected by spinal misalignment and pressure on the nerves. Pain is just a signal that, hey, something's going wrong in the body. So what we do is we try to evaluate you, find the spinal misalignments, and if you have those, we correct them.
So when you say evaluate, I think a lot of people think that going to a chiropractor involves a commitment of 3 days a week for a prescribed period of time, and every time they come in, they're afraid that the chiropractor is going to crack their neck and crack their back. And I say crack, I'm using, street terms. That's not what the medical community would refer to it as, but I think that's what a lot of our listeners may hear it as. But that's not the case. They don't need to be concerned about that. Is that correct?
Yeah. I mean, first of all, as far as the duration of treatment goes, I've heard people say the same thing. Well, once you go to a chiropractor, you always have to go. And in our office, your treatment is basically an election upon you. It's you decide how long you want to do the treatment for, but it's like anything. If you tear an ACL, you can't expect to be back out on the field in a month. It'll take, months to heal. And the same thing if you're looking for certain results with chiropractic. It may take a while.
All right, we're going to go to break in a minute. Before we go to break, I want to give everybody Dr. McCabe's contact information. Call Dr. McCabe, get in and see him. Reach Wellness, 856-866-0711. You can also visit cherryhilldisccenter.com. Cherry Hill Disc, D-I-S-C, center.com. We'll be back in a minute.
And back here on the Adam Malamut Show as we come to you on Talk Radio 1210 WPHT. Adam, all yours.
Thanks, Krause. So, Dr. McCabe, as we closed out the first segment, we were talking about some kind of general principles in chiropractic. Let's talk about some of the things that you're certified in. So you've got a laser that I personally experienced, folks. And I don't remember what I did, but I had intense back pain. It was abnormal, intense back pain. I moved in some particular direction, and I mean, it literally, it was difficult to breathe. And I called Dr. McCabe and I said, I don't know what to do. I'm laying here. You know, there's no position that I can get comfortable. I'm laying on ice packs. And he said, come over to my office. I've got something for you. I go to his office. He puts a laser on me. I will tell you that I am the first skeptic and cynic when it comes to, you know, voodoo medicine. This was real. I literally got off his table and felt 100% better. Tell the audience about that laser.
You know, the laser, first of all, it's the ML830 laser. It's FDA approved. It's a cold laser, so it doesn't increase any thermal aspect. There's no heat that goes on, but it helps reduce the inflammation, helps the tissue regenerate. It has shown with so many of my patients to reduce their pain levels immediately at times. It's very easy to apply. The patient doesn't have to do anything but lie there, and it runs for 10 or 20 minutes depending on the time that we put it on. It's great for shoulders. It's great for knees. It's great for neck and back pain. It's a phenomenal therapy. We've been using it in our office for a very long time. It's used throughout, especially the doctors at Disc Centers of America. It's used throughout them for treating multiple patients with disc injuries. So we use that, and we also use electroanalgesia, which is part of the Neuromed program, in which that actually will reduce patients' pain 50% after just one treatment. So these are just some of the therapies that we use in the office.
Doc, do people know, does the general public realize that therapies are so beneficial, or do we just naturally wait to find out about them when we have an issue?
You know, a lot of people don't know those treatments are available. And they come into the office, especially for chiropractic, they come into the office thinking that same thing about, I'm just going to get cracked and things like that. And some of them are very scared of that, by the way, as we talked about in the last segment. There's many ways to treat a patient in the office with multiple adjusting techniques. Some with you're using a handheld instrument that's very low force. You hardly feel it. It feels like a tap, but it's high speed, moves the segment the way you need to. Some people are just used to hearing that pop and crack and twist, and a lot of times you don't have to adjust the patient that way. We use different techniques that are very soft and gentle.
How about one question about fear? You know, I often feel sometimes, me included, that there's this sense of fear about getting a crack.
It's very real. It's very real. I have a lot of patients. As a matter of fact, I always tell a patient, when I see a patient, I always ask them, have you ever been to a chiropractor? And if they say no, I say, are you afraid? Are you scared? Because I want to know that. And the reason why I ask that is because there's that sentiment out there a lot of times that I hear. And I tell them one thing is, I am going to explain everything I do, and I'm going to tell you before I do it, so that you can be alleviated, that there'll be no sudden surprise or fear. And a lot of times I'll show them the instrument that I might adjust them with on the palm of their hand, so they actually feel exactly what they're going to feel on their spine. So there's no bending or twisting or cracking the neck per se that they're afraid of.
Folks, Dr. McCabe is able to be reached at 856-866-0711. You could visit him. He has a great video at cherryhilldisccenter.com. Doc, let's talk about traumatic injuries. So you have people that often come to you as a result of car accidents, as a result of slip and falls. How does that treatment typically go with the laser, with the other things that you're able to use to help people feel better? What type of results do you see?
Well, when you're dealing with traumatic injuries, whether it be a car accident, a slip and fall, even sports-related injuries, I treat a lot of athletes, especially in the high school athletes. You're usually dealing with not just a spinal misalignment type of problem, but you're also dealing with soft tissue. Soft tissue requires different therapies, and that's why we offer the therapies that we offer in the office. And again, people come in, they may treat multiple times a week, they may treat just once a week, they may be on a maintenance program where they only treat once a month, but they see great results. As I said before, the therapies that we have can sometimes reduce their pain 50% in just the first visit, and subsequent visits, of course, build upon that. And we work on the soft tissue as well as any spinal misalignment.
So, Doctor, one of the things that we talked about that I was really most excited with having you on the show, outside of the opportunity for you and I just to get on the radio together, one of the things we talked about is you're doing spinal decompression. And spinal decompression, when I hear that, and I know a little bit about chiropractic and a little bit about medicine, but when I hear spinal decompression, to me, that opens up a whole bunch of different thoughts. What is spinal decompression?
Well, so many people suffer from degenerative disc disease, where the disc has lost its hydration. It's starting to occur.
So let's stop there for a second. What does that mean, the disc loses hydration?
It basically has lost its water. It's a shock absorber that's between two bones in the spine. And when that starts to lose its water, it starts to thin, and two bones come closer together, which means the hole that was formed before starts to become closer together, which pinches on a nerve.
So for our listening audience, many of whom are in their car right now or sitting out in their backyard or at work driving a truck, could those be reasons that people feel chronic back pain?
Absolutely. It's very common, and it seems to be like the degeneration used to be in the older crowd, but it seems like I see more and more people suffering from this disc degeneration.
And those people who are suffering from it, and myself included, a lot of times we're going to the pharmacy and we're picking up things that are over the counter that it might be, an Aleve type of medicine. They call it NSAIDs, non-steroidal anti-inflammatories. But those types of meds have huge implications and huge impact on your internal organs, right?
Absolutely. They could be very damaging to the liver.
So does chiropractic have any kind of impact on the liver or the other internal organs?
No, it's actually completely safe as far as those organs are concerned. And the spinal decompression will actually help the disc heal itself if you do that non-surgical spinal decompression treatment, where it distracts the disc and allows the fluid to come back into it.
So before we get into how a disc heals itself, and we'll get into that in the beginning of the third segment. So somebody's driving a truck, and every single day they're sitting in the same position, and they get out of the truck the same fashion, and every time they get out of the truck, they feel the aches and pains in their back, and they have to stretch, and they may not even realize it. Sometimes they're subconsciously stretching, but throughout the day they're stretching. This is something that spinal decompression can help with, right?
Absolutely. Yeah, if you're suffering from back pain, especially if it's due to herniated discs or bulging discs, degenerative discs, spinal decompression, non-surgical spinal decompression is a great source for you.
There's a heavy concern in the union community right now, an opioid issue, because union workers are seeking pain relief. Is this a good substitute to help them go to work every single day?
Yeah, I mean, the opioid epidemic has just really come full blown right now, and you're really seeing the impact. And especially during this coronavirus pandemic, a lot of people can't get other treatments that they need, and they're suffering, and some are even dying because of it. Here, when we use non-surgical spinal decompression in my office and any chiropractic office, we're not using the medications that could possibly hurt internal organs as well as get you addicted, where it's a natural treatment. And believe it or not, most people on the table, they fall asleep. It's so soft and gentle.
Okay, we're going to go to break in a minute. When we come back, I want to talk about the healing of the discs. It's intriguing. It's amazing to think you can use in one hand the phrase degenerative, but on the other hand, the disc can repair themselves or be repaired. So when we get back from break, we're going to go to that. I do want to remind everybody, Dr. Charles McCabe, there are not a lot of doctors that are certified with the spinal decompression and have the equipment that he has to be able to perform these types of services. It is CherryhillDiscCenter.com. You can also reach him at 856-866-0711. Reach out, get a consultation, talk to Dr. McCabe. Don't keep waking up in pain. Don't keep walking around having to stretch, having to find ways to make yourself more comfortable. Talk to Dr. McCabe. We'll be back in a minute.
From the Malamut and Associates Law Studios, this is the Adam Malamut Show.
And welcome back, everyone, to the Adam Malamut Show. Real people, real perspectives, real opinion. We thank everybody for tuning in and listening every week to the Adam Malamut Show. As we come back to the broadcast, Adam, I thought I'd start the third segment, giving you the first 30 seconds to shout out to your daughter. I consider her a future star. She's now a freshman in high school, and the world is her oyster.
Krause, it's unbelievable. You know, time flies, and you being the amazing father that you are, and Dr. McCabe being the amazing father that he is, you know, we can all relate to the fact that, you know, watching our children grow up is really the greatest remuneration we get for all of the challenging times as parents that we have throughout the years. And thank you for the dedication. I can tell you that my daughter, who will probably be begrudgingly is listening to us, probably with the threat of, you know, if you don't, we're not having ice cream. But I can tell you that she'll be pleased to hear that tribute. And, you know, for all the parents out there who are homeschooling, listen, this is not going to be our careers. We are not teachers. We have a profound respect for educators, but this is what's necessary as a result of the public health concerns. So keep your chin up high and know that what you are doing is making a huge investment in the health, welfare, safety, and education of your children. That being said, it's a great opportunity to come back to Dr. McCabe and talk about our own personal health. I use this analogy on a lot of shows. We talk about when we're on an airline. Right now, I'd do anything to be on an airline. But we talk about when we're on an airline and the message comes on at the beginning of the flight and they say, if oxygen masks should be deployed, please put on your own mask before you assist others. And the same thing goes with health. You know, if you're not healthy, if you're in pain, if you're uncomfortable, and you don't have the ability to take care of yourself, you're not going to be able to homeschool. You're not going to be able to take care of your kids. So, Dr. McCabe, you tell patients all the time, and I know because you've told me, you got to take better care of yourself. Chiropractic, right?
Absolutely. Absolutely. It's so many people let their health go, and sooner or later it catches up to you. And then you're not able to help the people around you because your health is poor. I see it all day long, especially when you're dealing with disc problems in the spine, because a patient will sometimes have some degeneration or just some back pain, and they think it's going to go away, and they do what we talked about earlier. They take some pills, or you know, they do whatever home treatment they can do to try to make them feel better. Unfortunately, it doesn't work, and it continues to worsen. So that bulge or that degeneration will become a bulge. That bulge will become a herniation, and sooner or later you will be disabled.
So it's amazing to me, and I want to get back to the very notion that a disc can heal. So before we do that, I think you've got to explain to the listeners how the spine is comprised. Now, I had the ability, Dr. McCabe, and I didn't do a proper introduction. Dr. McCabe, in addition to being a chiropractor, was also a college professor and taught anatomy at Rowing College at Burlington County College, RCBC. I had an opportunity to sit in and listen to one of his lectures where he talked about the anatomy of the spine. So give the listeners a quick overview as to what the spine is, just so they understand when you're talking about a disc. People throw around, I threw out a disc, I slipped a disc, I bulged a disc, I herniated. What's the spine?
The spine is made up of 24 movable segments. There's 7 in the cervical, 12 in the thoracic, and 5 in the lumbar. And without getting too confusing with that, they're a bunch of little bones stacked up on top of one another. And in between each one of those bones is this disc material, all right? This is like a spongy shock absorber that doesn't allow the two bones to smash against each other. And what happens is, over a period of time or during trauma or something like that, it can damage this disc, and the disc loses the fluid that it has to be able to be that shock absorber. And if that disc loses that fluid, that disc will then start to degenerate and desiccate and get thinner and thinner. And if it does, it starts to put immense pressure on nerves and on the spinal cord.
No, we talk about, as we get older, we talk about, I used to be such and such a height, and now I'm not anymore. That's because of what?
Absolutely. As you lose height in each disc, you could lose inches of height in your overall height and how tall you are.
And that's just part of the natural aging process, right?
Yeah, it is. However, the better you take care of your spine, the better you don't so-called age. It's sort of like brushing your teeth. If you just brushed it one time and expect your teeth to stay clean your whole life, it wouldn't work too well. But if you brush it each day, you tend to not get as many cavities. So,
when I tell people that I used to be 6'7", it's a little bit more believable knowing my age, right?
That's a little bit of a stretch.
A little bit of a stretch. So, when you talk about the discs now, and you talk about the discs being able to heal themselves, how does that work?
Yeah, so, I've had patients come to me and say, my doctor said my disc can't heal. It's avascular, meaning it doesn't have a blood supply. And there's actually, I pull out studies in the office to show them. And a lot of my study information is from Harvard University, Stanford, Johns Hopkins, Mayo Clinic, things like that, to show them that, no, there's actually studies that show that you can do things to help that disc repair itself. And one of the ways to do that is to draw the fluid back in, which draws the nutrients and the oxygen back into the disc to allow it to heal itself.
So, why isn't everybody doing spinal decompression?
Believe me, I asked the same question because it is a phenomenal treatment. I've seen so many great results with it. I've had so many patients say to me, "Oh my God, you have saved me from disc surgery, from spinal surgery." Because when they do surgery, they just shave the disc or cut the disc. And you got to remember, when you do that, you are disrupting the tissue, and the tissue will never be the same. You'll get scarred tissue, you'll get adhesions, and so forth. And finally, when it gets so bad, they want to fuse the spine. And I've had patients who have been recommended for surgery and who have decided to do spinal decompression first, and then they literally did not need the surgery.
So, if you have the ability to not just heal the disc, but take people who are surgical candidates, to me, it's a no-brainer. If somebody tells me that I have to go in for surgery, and especially in days like today where I'm so worried about walking into a surgical center or a hospital, but I can walk into a doctor's office that I know has low foot traffic, is by appointment, and get a spinal decompression to heal my herniated discs, which I have from an old accident and an old injury. Where's the downside?
I don't see any downside, to be honest with you. I've treated tens of thousands of patients over the years. I've been practicing for 30 years. And that's how many visits I have done. And as far as spinal decompression, people lay on the table, and most of them are completely relaxed, if not just fall asleep. That's how gentle the treatment is. But done visit after visit, the distraction of the disc takes place, the fluid comes back in, the disc increases height. There's a study from Johns Hopkins University that shows an increase in disc height, right, with a 90% pain relief with spinal decompression.
For the listeners, again, I'm here at Dr. Charles McCabe is our special guest. Phone number is 856-866-0711. Please reach out to Dr. McCabe. You can also visit his website, cherryhilldisccenter.com. Dr. McCabe is associated with not just Cherry Hill Disc Center, but also Reach Wellness, Again, he has a holistic approach to keeping not just your spine healthy, but your entire body healthy. And that dovetails into your immune system, right?
Absolutely.
So how does chiropractic affect your ability to maintain a higher immune system?
Well, as I mentioned before, the brain runs the entire body, and the way the brain controls the entire body is through the spinal cord and out all through the spinal nerves. But those spinal nerves and all the nerves in your body don't just carry pain signals. They carry all the signals to tell your immune system how to react to things and how to fight. Your digestive system to what nutrients it needs to absorb and things of that nature. So it's basically running the whole body. And if you cause any type of pressure on nerves, you're interfering with that communication system between the brain and the body. And therefore, it can affect all the systems, the immune system, the digestive system, the respiratory system, and so forth.
Okay, we're going to take a break. When we get back from break, we're going to talk a little bit more about spinal decompression. We're going to talk about what, if anything, you feel after your first treatment and how long you have to treat. We're going to talk about health maintenance. We're going to talk about how, as a society, we can make ourselves healthier. Again, special guest today, Dr. Charles McCabe, Reach Wellness, Cherry Hill Disc Center. We'll be back in a minute.
Real people, real perspectives, real opinion. Now back to Adam Malamut.
Happy Saturday night. This is Adam Malamut, the Adam Malamut Show. Thank you for joining us again. Tomorrow, well, actually, this past Thursday was the kickoff of football season, but it doesn't really count since my Philadelphia Eagles start playing tomorrow. So, special guest, Dr. Charles McCabe, Reach Wellness, Cherry Hill Disc Center. For those of you that have been listening, I can't ask you in strong enough terms. There's no better way to take care of yourself than getting ahead of the problem. For you in a car, if you have a need for an oil change, you take your car because you want to preserve the asset and go get the oil change because nobody wants to pay for a new engine. If you have a flat tire or a tire that is losing air, you go, you fill it up. If there's a hole in it, you go and get it patched. You do what you need to do to take care of your car. Our bodies we neglect. And we neglect until we end up laying on our backs in a hospital bed saying, my God, I wish I didn't neglect my body. Doc, how often are you seeing people neglecting their bodies?
Every day. Every day. Well, most people come into my office at that point. They sometimes even past that point. They've already gone to the hospital, and you know what? The hospital says there's nothing I can do for you. You have to leave. And so I see the person who's already been through the family physician, the orthopedic surgeon, the hospital, and everything else, physical therapy. And, you know, I tell them, you know what? You need to start taking care of your body, and then I give them a plan.
So what would a typical plan look like?
Well, depending on what's going on with you, meaning the patient, I have to evaluate the patient to see what can we first take care of the problem that's get you out of pain, in other words, because that's what usually brought you in. And then after we've taken care of getting you out of pain, in other words, possibly doing any type of chiropractic treatment on you, any therapies that we've already mentioned before, then we start talking about overall health. And would that require losing weight? If it requires losing weight, then we could develop a weight loss program for you. If it is about not getting the proper nutrients in your body and so forth, then we talk about your diet.
So as we're all at home and we're coming into what we all know is the gluttonous season, right? The fall, we're sitting around, we're watching our fall sports, participating in our fall activities. One of my favorites, and this is not a paid endorsement, but the pumpkin scone is back at Starbucks. I saw that it was 500 calories. It was kind of alarming, and I'm not going to lie. I think that it may have turned me off for at least a couple weeks until I give in. But then we have Thanksgiving coming up, and then we have all of the holidays, whatever you celebrate between Thanksgiving and New Year's, and the New Year's celebration, our activity level decreases with the weather changes. Historically, people are outside less. These are all very important reasons for you to get it together now, right?
Absolutely.
Why wait till the new year? Start that plan now.
Right.
So do you have availability to take new patients right now?
Absolutely. If you call the office, the front desk has been informed by myself to make sure that any patient that needs to get a new appointment, we get them in as soon as possible.
It's not always going to be like that because I'm expecting you to get a big response from this show.
One thing I want to ask you, Doc, to point out is for the listening audience, talk a little bit about COVID compliance. There are many people, many listeners out there who still don't realize that they do have the ability to come to your office and interact and get treatment.
Absolutely. First of all, there's signs on the doors that everybody needs to be wearing a face covering when you come into the office. We're asking the questions to see what you've done in the past, to see if you've been out of the country or exposed to any of the COVID type of infections. We're also taking temperatures. The rooms are constantly wiped down with alcohol, everything, the wipes, the doorknobs, the tables, the doorknobs, everywhere anybody even touches. So we're making sure we cover all the COVID compliance, and it's safe for every patient to come in. But getting back to the availability, spinal decompression requires a decent amount of time to treat for the patient. So it's not like we can have 1 million people at one time. It's a very time-consuming type of treatment, as far as 30 minutes each time. So there's not a high foot traffic type of scenario that goes on, which also lessens the possibility of any type of COVID infections.
So, when you talk about getting people in and getting appointments and the amount of time, I don't want people to think that the amount of time it takes is going to take away from homeschooling and all these other things. But if you think about the amount of time that people are uncomfortable, in pain, dysfunctional, right down to body fatigue and exhaustion at the end of the day, these types of treatments are going to extend the day, right? These types of treatments are going to make you feel better. You're going to get more out of your day.
Absolutely. When you go home and you're tired and sore because you're in so much pain, you have to lay down. You have to lay down earlier, which means your day ends earlier. When you're tired and sore, you're also possibly shorter with family members, and you don't have the patience per se to deal with any type of other problems that are going on. So not being in pain, of course, can make you feel so much better and extend your day and be more pleasant, basically, in the house.
Now, you're located in Maple Shade, New Jersey.
Correct.
That is, and it's a little deceiving because Maple Shade is a larger township, so people may think there's issues with accessibility, but tell the listening audience how accessible you are.
Actually, I think Cherry Hill is the one part of Cherry Hill is about 1,000 feet from my Maple Shade office, located right in between Cherry Hill and Moorestown in Maple Shade. If you are traveling from Moorestown into Cherry Hill and you go through Maple Shade, it would literally take you probably about 30 seconds to a minute.
So you're right off of Route 38.
Right off of Route 38, yes.
Right by 295.
Yes.
Accessible to the Ben Franklin, Tacony Palmyra, Betsy Ross bridges.
Yes.
So Reach Wellness, Cherry Hill Disc Center, 856-866-0711. Dr. Charles McCabe, we're talking about chiropractic, we're talking about the laser, we're talking about weight loss, we're talking about traumatic injury, health maintenance, and spinal decompression. We're talking about your health. For those of you that have been listening to the show, for those of you that have tuned in on this Saturday night, this pre-Eagles game Saturday night, take care of yourselves. Take an opportunity to do something for you. If you have the back pain, this isn't a paid endorsement. I could have had anybody as a guest on this show. I chose Dr. McCabe because I think the messaging is really important. As somebody who has woken up and has lived with back pain, who has had it alleviated as a result of not just using Dr. McCabe as my physician, but as a close personal friend, having the comfort of going to him and the trust that he wouldn't steer me wrong, it's really been life-altering. So, again, before we wrap things up, Dr. McCabe, I want to thank you for coming on. I hope that people have listened and heeded your message. I think that there's chiropractic, God, we could talk for hours about chiropractic, and we have.
Right.
but I think that there's a great opportunity here for people to really take ownership of their health. So before we wrap the show up, I want to remind everybody that we need to continue to stay socially responsible. We need to continue wearing masks. Young people are carriers for the COVID-19 disease, illness. We need to continue to stay safe. I wish you and yours the happiest and healthiest of days to come, but it's not going to happen unless we take care of ourselves. Reach out today, reach out tomorrow, reach out to Dr. Charles McCabe, Reach Wellness, CherryHillDiscCenter.com, 856-866-0711. I'm Adam Malamut for the Adam Malamut Show. I want to thank everyone. I'll talk to you next week.
Thanks for listening to the Adam Malamut Show, a Jacob Media production. If you're interested in learning more about the power of the radio hour, contact Joe Kraus at 267-261-3428.
This program is a paid commercial announcement and does not reflect the views of WPHT or its management. Today's program has been pre-recorded.